All right, I'm gonna prep some meds coming into the med room over here and get my hands clean. I need to pull meds for Miss Kelly Smith, and her date of birth is 6/15. It is 6/15/63. It's 8 o'clock, and they say that she does want her flu vaccine today. So I'm gonna pull all of my 8 o'clock meds all at once and take them into her. So it looks like we've got prednisone, 40 milligrams. So that is gonna be here. And I'm gonna have to do a calculation to figure out how much that is gonna be. Okay. And I have 40 MEQs of potassium due. So let me find my drawer here. And these are 20 each, so I'm gonna pull 2. Put those into my med cup. I've got Lasix, 30 milligrams, PO daily, 30. And these are 20 milligrams each, so I'm gonna do 1.5. So let me do a good check here. This is 20 milligrams of Lasix, and that'll be 1.5 tablets. So I'll have to split that. And 20 MEQs potassium, so 2 pills, perfect. Okay, and then I've got my flu vaccine. So I will go ahead and draw that up so I don't have to do it bedside. And that is gonna be 0.5 mLs once. So go ahead and clean my top. Pull a syringe. Since that's 0.5 mLs, I'm gonna try to find a 1 mL syringe for it. Here we go. I'm going to use my blunt tip needle. I'm going to draw back the same amount of air of the dose that I'm going to give, 0.5. I'm going to inject that in one-handed. Inject the air in, and at this point I can flip it over. And I'm going to pull in more than I need because I'm getting bubbles. So I'll just go back and forth until I have what I want there in my stopper. 0.5 mLs. I'll change over that needle at the patient's bedside so they know they're getting a fresh needle. Got a cup for water, and I just need something to measure out this prednisone with. So it's 15 per 5 mLs, so that's, I need 45, 10. It's 12.5 mLs. Those are empty. So I would then pour in 12.5 mLs into my little measuring cup. This looks like it measures up to 10 mLs. So I can either draw up extra with a syringe and inject it back into the cup if I had a cup. All right, so just to double check here, I'm gonna come outside my patient room for my second check. So this is Kelly Smith's room, and I am giving her her prednisone, which is 12.5 mLs here. And I'm gonna give her 2 tablets of that potassium, which is 40 MEQs. 1.5 tablets of the Lasix, and a flu shot. Okay. Knock, knock, knock. Can I come in? Hey, Miss Kelly. Let's see my hands. How are you doing today? Pretty good. Pretty good. I have some medications for you this morning. Is now a good time to give those to you?
Yeah.
Okay.
Sure.
Can you confirm your name and date of birth?
It is Kelly Smith, 6/15/1963.
All right. Is it okay if I sit you up?
Yeah.
I have a few things for you to swallow, so I don't want you to choke.
Yeah.
Okay, so I confirmed your name and date of birth, and I can also take my scanner and scan your bracelet with it. Beep. All right, so I have 4 different medications for you. I've got some liquid prednisone. That's a corticosteroid that'll help with inflammation or maybe help you breathe easier if you're having
that would be good.
some kind of respiratory flare-up. Okay, so I'm just going to get this down on eye level, measure my 12.5 cc's, and I'll give that to you to take.
Yeah,
All right.
that didn't taste very good.
Oh, sorry about that. I have a little bit of water to wash it down with. I'll give you that. And I have got for you 2 potassium tablets to take. They're kind of big pills. You okay with that?
Sure.
Okay. And then I also have for you, I have 1.5 Lasix to help pull that water off your legs. Does that sound okay?
That sounds great.
Okay. So I'll give those to you to swallow. They would have taken them out of the packaging for my real life patient.
Yes.
All right. Thank you so much. I have also checked the expiration dates on these medications, and they're all within dates.
Good.
Okay. And then I have your flu shot. Is that okay to give to you this morning?
Sure.
Okay, great. I'm going to go ahead and put some gloves on. And is that okay if I put that into your muscle on your right arm?
Yes.
Okay.
That would be a good place.
If that didn't feel good, I could have done it in your thigh or in your hip.
Oh no, I think the arm's better.
Okay, well, that's right. Well, we'll do that. All right, so I've got my gloves on. I'm going to go ahead and put on a fresh needle for you because the sharper they are, the less painful they feel.
Oh, good. Thank you.
What do you think for my favorite patient?
I'm your favorite patient. Oh boy.
Favorite. All right, and I might have a Band-Aid on hand, but I don't right now, so you just try not to bleed too much.
Okay, I'll do my best.
Okay. So I'm just gonna clean that site on your arm. Don't worry, I'll warn you before I stick you.
Okay.
Okay. Let that air dry and clean. Just squeeze this out to the end. There we go. So I'm gonna pull that skin to the side using my Z-Track method. It's slippery. There we go. Just pull it to the side a little bit. I'm going to dart it in. Make sure I'm in the muscle. Inject slowly if the patient's tolerating. You doing okay?
Yeah.
All right, just keep breathing. Okay, pull that out and let that skin go back. You did great. I'll close that sharp right here. I'm not hearing a click. It's closed. It didn't click. And I'm just going to carefully walk around and put that in the sharps. All right, how you doing after all that?
Yeah. I'm fine.
Not the best, but hopefully we'll get you out of here soon. Oh, do you need any more water?
Yes, that would be great.
All right, I'll go and grab you some water. And you have got your cowbell. It's tied up there, but I'll bring that back down too. Are you comfortable as you are, or would you like to lie back down?
No, I'm comfortable.
All right.
I like this.
Well, thank you so much, and I will see you in a little bit, but don't hesitate to call me if you need me, and I'll bring that water right back to you.
Okay. Well, thank you.
All right.